Bismillahirrahmanirrahim. Today our topic is to discuss the different types of the IV fluids. So let's start the topic. Different types of the IV fluids are the normal saline, dextrose normal saline, which have D5, D10 and D25, Ringer solution and mannitol solution. The first one is normal saline. The normal saline have the 0.9 gram sodium chloride in the each 100 ml of the normal saline, and it is used in the dehydration and also used in the wound washing. It is also used to give the injections, and it is also used in accident and the diabetic patient. The second one is the dextrose normal saline. The dextrose normal saline consists of the 5 gram of the dextrose in each 100 ml of the normal saline, and it is used in the dehydration. It is also used in the hypoglycemia and also to be give in the insulin shock. Caution, it is not used in the diabetic patient. D5, D10 and D25. These are the prohibited to give the diabetic patient. The third one is the Ringer solution. It is also called the Ringer lactate. The Ringer solution consists of the sodium lactate, potassium chloride, calcium chloride, and it is also used in the dehydration, also used in the burn and accident, and also used in the dizziness and hypotension. The last one is the mannitol solution. The mannitol solution is also called the osmotic diuretics, and it consists of the 20 gram of the mannitol in each 100 ml of the solution. It is also used as a diuretics, also used as a oliguria, and it is also used in the edema. Thank you so much.